I am Precious Mzea Sakaleji. Good afternoon and thank you for joining me. Welcome to Camnet TV Midday News. The headlines. Deputy Police IG Charity Katanga warns people peddling misinformation ahead of the polls. The expiry of medicines at ZAMMSA annoys stakeholders. And UTH justifies failure to pay gratuity to workers. Join me with the news in detail after this commercial.
2021 is finally here. Zambia is at the crossroads heading towards general elections this August. In the world where fake news, biased reporting on national issues has become the order of the day, in a world where social media in most cases spills lies and exaggerated information, insightful coverage, Zambia needs one media. Living in a country where people are slowly promoting tribalism, hatred, bitterness and revenge, political temperature is heating up and people's hearts are perplexed. Zambia needs one media. Zambia being a Christian nation living under the lordship of Jesus Christ, the nation cannot afford a compromised gospel. Zambia needs a prophetic media house. For hope, peace and unity, Zambia needs Camnet television. For non-biased, factual reporting, balanced opinion, accurate news coverage, Zambia needs Camnet television. For national projects and development of our beloved country Zambia, watch Camnet TV on channel 274 DSTV, channel 98 on GoTV and channel 106 on Topstar. Remember, Camnet TV is not just another channel.
And now the media news in detail. Deputy Inspector General of Police Charity Katanga has acknowledged the need to curtail misinformation, saying it may be detrimental to the country's peace and stability ahead of the August polls. Speaking during the launch of the PANOS Institute Southern and Africa and the Bloggers of Zambia project to curb misinformation and promote democracy, Mrs. Katanga says addressing misinformation requires concerted effort to combat. Mrs. Katanga says the police is doing everything possible to avert political violence which sometimes comes about due to misinformation. And Mrs. Katanga has called for closer collaboration through engagement and consultation with the media in view of harmonizing work relations to avoid misunderstandings and infringement of each other's responsibilities. And PANOS Executive Director Vusumusi Sifile says the country has seen a rise in the use of misinformation to deceive members of the general public due to bad intentions.
Misinformation is defined as false or inaccurate information, especially that which is deliberately intended to deceive. If not well handled, misinformation can lead to instability, thus affecting governments, enterprises, and consumers alike. With an ever-evolving challenge to differentiate the truth from lies, sharing unchecked misinformation establishes the false narratives that appear real, which then go viral. But to combat misinformation, there is a need to take an approach that has the government and the civil society sectors working in unison. And as Zambia goes to the polls in August this year, it is highly expected that misinformation will be on the rise. But in order to mitigate this, the PANOS Institute Southern Africa and the Bloggers of Zambia have launched a program aimed at combating misinformation and promoting democracy. Speaking during the meeting in Lusaka Tuesday, Deputy Inspector General of Police Charity Katanga acknowledged the need to curtail misinformation, saying it is detrimental to the country's peace and stability ahead of the general elections. She says addressing misinformation requires concerted efforts to combat among stakeholders.
Because some of the offenses now we are looking at the Section 57. Yeah, I'm sure the journalists have read Section 57 of the Penal Code. It talks about you have issues of sedition, you have issues of treason and others. Among that, you have issues of political, those that are perpetrating ethnicity differences, tribal, and all that. It is bordered into this. So let us collaborate. We appreciate this, but this cancer is so serious. So we'll follow it with keen interest to ensure those that want to perpetrate violence through misinformation are dealt with. and we will take keen interest, especially that people are contesting for political power. If
Mrs. Katanga assured cordial relations with the media.
It's just that, so that whatever you are doing is transparent. Because your work, you cannot be hidden. You need to cover it and everyone is able to see. But when you relate to the holders of these offices, the commissioner of police or the officers commanding at a district, sometimes even at the level of the officer in charge, depending on what you are covering, maybe you are covering the level of the district, have that collaboration, then you are going to find that your work is easier. Because others, it's not always that arrest is necessary. Sometimes we can simply say what you have committed is an offense. Next time, don't repeat it. But now, if you have that kind of bossy and you want to show there, then a constable on the ground will show you that he has 10 powers of arrest. So what is just important is what? Rapport and a lot of sensitization.
Meanwhile, PANO's Executive Director, Vusumuzi Sifile, notes that the country has seen a rise in the use of misinformation to deceive members of the general public.
Where criminal activity has taken place, the law takes its course. But like I mentioned, that the online space is developing at a very fast rate, which requires all of us to be alert. We identify some of the purveyors of misinformation. In some cases, we engage them. In some cases, we engage those who can help to stop them from purveying misinformation.
Patrick Soko, Camnet News in Lusaka.
The University Teaching Hospital UTH says it has faced the payment of gratuity of contractual workers at the institution. UTH Director Clinical Care and Chief Medical Superintendent Alex Makupe has told Camnet TV News that the institution is unable to pay all its contractual workers their gratuity at once due to limited resources. Dr. Makupe said this is in response to complaints raised by contractual workers at the hospital that management has been unable to settle 2-year gratuities despite signing new contracts. And Dr. Makope said the institution will continue making replacements whenever vacancies are identified. He says contractual workers who have served longer will be prioritized when it comes to filling the identified vacancies.
The reward of every hard work comes in many forms, but the end results put a smile on the face of the laborer. Contractual workers at the University Teaching Hospital had earlier informed Camnet News that they have not been paid their rewards, commonly known as gratuities, for the 2-year service they rendered to the institution. The workers complained that some of their colleagues have died, while others have ended up contracting COVID-19, yet there is no news of them receiving their gratuities anytime soon.
Tinambia na utumu contract moja batupasa graduate. So paena sila contract bantu zatembekezani for 1 month. Zakustan prepare ndarama zanu. So paena sila 1 month tinambekeza so natipase ndarama. So bena ngo banaenda kufunza kamene kuja banaba uzati embekezani. So chameti pemba chakuti ba UTH stiza pale batika because bena ngo bana saving from 2018 bana mwarira bena ngo bakufana ma TB bena ngo bagwira na corona yameneyi.
And UTH Director Clinical Care and Chief Medical Superintendent Dr. Alex Makupe has told Camnet News that the institution is no longer capable of paying all contractual workers their gratuities at once.
I do also acknowledge that in trying to fill up the spaces in terms of human resource needs in the area of general workers, we've had to hire some general workers over a quite significant number of years at the UTHs, and they need gratuity. Through the locally generated funds, the University Teaching Hospitals has been paying gratuity over the years, but this year, last year, what we've done is to stage the payment. So we cannot pay the entire group of general workers, there are many. So what we've done is to phase it, get one group, pay some lump sum, and then mobilize more money, and then pay the remaining group. So UTH management remains committed to ensuring that gratuity is paid to our people, and that there should be no much worry And what we are going to be doing as well is to continue making replacements where we identify a vacancy for general workers under government. We try to pull those that have been with us longer and then putting them on the government pay. And so we are committed to ensuring that we reduce the number of casual workers at the University Teaching Hospital and getting them under full government employment.
The doctor has since thanked the workers for the good work attitude towards the patients and the effort they have continued to render the institution. Prudence Chota for Camnet TV News.
In other news, various stakeholders have expressed disappointment over Monday's revelation by the Minister of Health, Dr. Jonas Chanda, that essential medicines have gone to waste at the Zambia Medicine and Medical Supplies Agency, ZAMMSA, formerly called Zambia Medical Stores. In an interview with Camnet TV, former Pharmaceutical Society of Zambia President Jeremy Kanyika says the danger in leaving expired medicines to chance is that it may find itself in the wrong hands, thereby endangering the lives of the people who may consume the expired drugs. Mr. Kanyika has meanwhile called for a serious probe as to why the medicines were left to expire when various health centers did not have most of these medicines.
A paper in the hand written with ink in the name of a prescription is a daily thing for many people that frequent health facilities countrywide. This is so because these health facilities have no medicines to give. Instead, people are asked to buy their own medicines, with the most common drug to be given is paracetamol, commonly known as Panadol. With all these complaints from the patients and the caregivers, medicines were being kept under lock and key at the medical stores now called ZAMMSA to expire. This is a scandal that was unearthed yesterday by Health Minister Jonas Chanda when he visited medical stores facility.
The real danger, apart from the incompetence in procurement and keeping those things expired, the money that government is wasted and the denial of services to the patient, the real danger is that with the corruption that is rampant in some of our people who are pilfering drugs, they will come and take this same expired thing, it will find itself in a private pharmacy somewhere, and unsuspecting Zambians are going to buy this. When it expired 4 years ago, you are keeping it here. So I just hope there are not those cartels that are getting expired products and going to use them now in pharmacies. They're killing the people. That will be criminal negligence, and will deal very firmly and very strong against those kind of people.
And commenting on the matter, former Pharmaceutical Society of Zambia President Jerome Kanyika said what happened at the medical storage facility is a clear demonstration of Zambia's poor procurement system, which has the potential to put the lives of many in danger.
These may find themselves in the hands of wrong people who may end up selling the same medication to the members of the public. And as you know very well that once the medication have expired, it means that they lose you cannot guarantee the safety of the medication. They tend out to be poisons that can be very dangerous and can harm your body organs like the kidney, the liver, and other organs like the skin. So these are some of the worries that we usually have when we say that expired medicine are left like that.
And Mr. Kanyika also called on government to investigate this matter before destroying the meds so that the truth can be established.
We need first to probe to see what led to the expiry of those medications, knowing very well that in most of the health facilities, medications were not made available, but we had the medication expired at the central warehouse. We need to find out exactly what really happened, and this all indicates to what I've been talking about in terms of how rotten the procurement system were at the Ministry of Health headquarters. But it's good that now the procurement system has gone to medical stores.
The Minister of Health yesterday directed management at ZAMMSA to submit to his office a comprehensive report on drugs that have expired and those that have been recalled and the amount involved before the close of business on Tuesday. Sharon Kalimbula, Camnet News, Lusaka.
Well, that news item brings us to the end of Camnet TV Midday News, but before we go, the headlines once again. Deputy Police IG Charity Katanga warns people peddling misinformation ahead of the pause. The expiry of medicines at ZAMMSA annoys stakeholders, and UTH justifies failure to pay gratuity to workers. Well, that is all. Thank you for joining me. I am Precious Mzea Sakaleji. Remember to always wear your mask, avoid crowded places, wash your hands for at least 20 seconds or use alcohol-based hand sanitizer, and avoid congested places. Thank you for joining me. Stay safe and good afternoon.